All right, everyone, I'd like to bring this Health and Human Services Committee meeting to order. It is July 16th, 2024 at 3:45 p.m. Today we have a special guest with us, Cheryl Roberts. Come step to the hot seat.
How are you guys?
And Cheryl will be giving us an update
Guys, we are
on
recording.
the Wellness Hub.
Thank you. Thanks for inviting me, and glad to do this before your full committee meeting. I've been, working with the chairman and the deputy chairman, and several others on this, more recently, of course, Kathy, for several years now. So we updated you a couple of months, or maybe a year ago, I don't even know. But wanted to just give you a quick update. So, a lot of this came out of this potential intercept model mapping that we did. We determined, the county and the city determined that we really need, more services in the county, in a location close to the city with the services, particularly housing. So if you want to go to the next slide.
Don't dare touch that keyboard.
I'm not touching anything. Okay, so just in case you don't know, the Wellness Hub, there's near the county jail. It's a 4.5 acre site. It was donated to the Greenberger Center. And you all know this now, so we can go to the next one. And this is just an aerial view of the 4.5 acres. So great, it's a great location. And Kathy Eldridge has been amazing about supporting this. And, it's a great location because there's no residential, uses around. So, okay. So you've seen this before, I think, but some things have changed. And this is just a rendering. It's going to change. We have a new developer we're about to sign a contract with, and there'll be a new architect that they'll bring on. But this is just to give you an idea. I think the buildings will still face in that direction because it's nice. The view is nice, but out in that other direction toward the plant. But the building on the left, the Safe Haven Shelter, is still, the use that we had talked about a year and a half ago. 25 SROs, single room occupancies upstairs for people who can't, maybe are suicidal, can't, or thinking about it, can't be upstairs on their own. They can be downstairs. But if you're stable enough, you could be in the SRO upstairs, have your dog. And there's a picture of it in just a moment. Downstairs will be for co-group housing, and also hopefully a kitchen in there, and space for people to be who can't be upstairs. The permanent supportive housing, 35 units, that was to be the detox center for People USA, but they lost their funding quite a while ago. So we pivoted and decided what the county needs, and this was decided all together, was more permanent supportive housing. So that would be 35 units. So let me finish the other building, then we're going to talk about who's going to run all this stuff. So the other building, first of all, that was designed twice as big as it's supposed to be, so it's not going to be that big. But OMH has been talking to us about issuing an RFP for 120-day temporary supportive housing. This is very, very intensely supported temporary housing. The staffing ratio is very high. They're offering $120,000 per bed a year, so that will help. It's really for people who are coming out of, CMH, people who really need that level of care. 10 to 14 units. We also hope to kind of piggyback on the development because OMH will provide capital and also operating. So it's not just $120,000 a bed per year per person, it's capital as well. So we're hoping to piggyback on at least bringing the infrastructure to that building, and then raise some private capital or perhaps some government capital for a welcome center, a much smaller version than what we had talked about last time, because frankly, there's no way to really pay for that, short of getting some private funding or maybe some member items. But it would have things like hopefully shower, laundry, and peer offices, and a place kind of like the air traffic control center for the mail. Yeah, we've been talking about mail. It won't be the post office probably, but we're looking at getting mailboxes in there. We've also talked to the pharmacy about somehow getting deliveries over there for drugs, so people won't have to come back and forth. So that's the Wellness Hub. And before we go on to the other slides, let me just say that we have been working with a company called Repco, and the county folks have met with them too. They have been in business for 40 years. They are in the business of developing supportive housing and actually operating it, which is great. Because the Greenberger Center, just to be very clear, we don't want to operate this. We are the master developers. We're going to facilitate, we'll help, we'll do whatever we can. We are not going to build, develop, or operate these units. Repco would do they would do the permanent supportive housing that is operated. Columbia, Mental Health Association of Greene and Columbia Counties would do the shelter, would actually operate it. The 120-day beds, if we get those, we're looking at another organization to do that, which Dan Almasi, I know, came in. He's been instrumental in making these connections. Perhaps a company called Gateway. The great part about all of that is that they would be bringing staff, or hiring staff, because I know there's a concern about staff. And they would hear you on that. So at this point, we are very grateful for the 1.5 essentially that the county has allocated, 20,000 of which has been used for different preparatory work on the site, and we are trying to work with Rocket Simmons to get that contract done. I haven't seen the draft, but hopefully soon, so we can.
I believe he was waiting on information from your people.
Yeah, we sent it the same day he asked on the 12th, so hopefully he's got that. If not, he didn't get it.
I didn't get it. No.
He should have got. I mean, Damon sent it to him.
He was out yesterday at a.
He was at federal trial court.
Okay, so that's good to know. So I reached out, but I will make sure he gets that again. And then we'll sign hopefully the contract with the county, and we'll sign a contract with Repco and get this moving. I can take you through a little bit more if you'd like. This is a picture of the SRO, just a rendering of what an SRO might look like. And then if you go on, Kelly, we have information on cost savings. So I'm happy to take you through that if you'd like.
I can share this with everybody.
That's easier.
Yeah.
Yeah.
Anybody wants.
Yeah, it's just, 1.2 from the hospital, I think, and or 1.1 from the hospital, 1.2 from the county in savings for homeless housing. So that's the hospital. You can go on real quickly. And then this is to the jail, 32,000. I think it has to be more than that, but anyway, that's a conservative estimate, 10% reduction in mental health related costs. You can go on. And then police department, I think that's I got to believe that they're going to be saving more than that, but that's a conservative estimate, 10% reduction. And this, I think you may know already, this is from the SIM. We already are saving money, the county is, because we're using VAN as opposed to EMS services to pick up high utilizers who've been calling. And then these are some of our partners. Some of them I mentioned, Repco is down there, Greenberger Center, Greenport, Hudson, and Columbia County. And then this is where we're looking for assistance from the state. And Repco will look for federal funding as well. So I think that's it.
So Cheryl, what the plan is moving forward is that once the contract is agreed upon by both parties, we'll have a special meeting prior to the Board of Supervisors meeting in August.
Okay,
And with a resolution to be voted on at the Board of Supervisors.
perfect. Okay. Just let me know. And you want Repco there as well as the Greenberger Center?
Might not be a bad idea.
Okay, happy to do that, yeah. And we can get Damon and Seth there too from my side. Whoever is that during the day or at night?
That's at night.
Okay.
7 p.m.
Okay.
The special meeting will probably be, I would say, no earlier than 6:45, 6:10. There might be some questions, but I think pretty much the board is educated.
In terms of the various services that are going to be offered on the site, will there be counseling? Will there be daycare? Will there be other kinds of things for these populations on site?
The supportive housing, yeah, it comes with some of that, those services. I would hope that we can work with Dan, maybe get some supportive services.
Sure, that would be an evolution. I think the first step is to codify this relationship with Repco, secure the capital funds to you know, and then fine tune the architectural details of what it is we want to build. The conversation of my department setting up a satellite or other providers, maybe having some space, it will evolve, certainly. Initially, it was brought up as to whether our department could relocate. The answer was no. I understand that, but, yeah, we could have a worker out there on every other day basis to do screenings, assessments, to simply talk informatively about our services, to invite people to come to our open access, things like that. Absolutely.
Security.
That's a good question. I have to talk to Repco about that.
Yeah.
I don't know. I would imagine they probably do have some kind of security in their buildings, but yeah. Good, good question. I'll let you know those.
In terms of, if I can just circle back to the 120 step down model that Cheryl talked about, that's the one that we're still in conversation with the New York State Office of Mental Health about the RFP and so on and so forth. The staffing model there is incredibly comprehensive. It's almost at the point where it's a challenge because they require a multitude of professionals, licensed professionals, nurse practitioner, licensed clinical social worker, certified peer specialist, certified recovery peer advocate, certified multiple professionals, so that these individuals that are there for that short period of time have everything but the kitchen sink thrown at them as far as support, resources, and so on and so forth, so that they can leave after 120 days and be in a much more stable place to then move on to, let's say, the 30 or 35 units of transitional housing, or maybe an apartment in the community should one be available. I know that still has its challenges in terms of finding housing in the community, but they really wrap around the services around that individual. But that model has its challenges, which is, would be nice if we could lock in Gateway Industries for Ulster County. They're a behavioral health provider. If they're a housing provider, they provide a PROS program similar to what the Mental Health Association of Columbia Green offers. So they come with a really deep resume, similar to Repco as a developer. Gateway is a provider of housing services and behavioral health services. So they would bring the staff as well. So it would improve the likelihood of that model really working very, very well. The idea would be somebody comes to the homeless shelter, gets stabilized there, moves on to the 120-day step down. From 120-day step down, they should transitional housing unit be available, they move into that.
The only thing I want to add is that this isn't going to solve all the problems. There are some individuals in this community, and because some of them are in front of me in court, I'm not going to say who, but I think probably some of us know them. And I'm not sure anything will, short of, repurposing a jail cell and like they did in Albany, or unfortunately keeping them in jail. But I mean, I hope that we can do something for them eventually. This is not going to be for everyone. There are a few that are still going to need, I have ideas about what they need, but it's just to be clear. But it will help a lot of people that are the high utilizers that really cost the county a lot of money.
So one last question, you said the welcome center is going to probably be downsized because it's disproportionate on the model that you showed us. Is there any room for additional supportive units in the event that the welcome center is downsized, or is there a state recommendation or regulation that supportive housing units come in, 25 or 30 unit blocks?
Well, the RFP, as I understand it, is only up to 14 beds. So I don't know why that is necessarily, but it's
Probably a state thing. Does anybody know?
beds.
Isn't there a state regulation about how many units you can put together if someone that you can find someone to manage in one site? I believe there is.
They have a standard, I don't know if it's
Yeah.
regulation.
Yeah.
So are you thinking about the IMD rule? It's a 16-bed rule.
I'm sorry, I don't know. I wasn't prepared to have this conversation until I didn't read any of my notes.
No,
before.
this wasn't in the notes. I mean, there is a rule about if you have a community residence, you can't go above 16 beds. This is not community residence, it's supportive apartments.
Okay.
There is just to go back for a second, for the supportive housing, for example, there's a report case called Olmsted, and Olmsted, that might be what you're thinking about too. Olmsted says you can't have more than 50% of your beds for people with mental illness or apartments. So that's why in that 35 unit permanent supportive housing, half of them will be people with mental illness, chronic mental illness. A quarter will be returning citizens from incarceration, and a quarter will be chronically homeless.
Okay.
We can't have all.
Did they raise it? I thought it was 25%. Did they raise it? It was it was like a ratio. It could only be like a quarter of what your total population was. Did they change that?
I've always thought it was 50%, Kathy, I'll check, but that's what OMH, when we were having with them, that's what they said, is 50%. Yeah.
That's helpful, thank you.
I guess coming from the assisted living population, we were at 25. Because of,
Was it Olmsted? Because of Olmsted, though.
just because of, you know, the caretakers, the caregivers there. So that they weren't, you're not qualified for site at the assisted living, so it's just at 50%.
So many rules.
Yeah.
Making it explode.
Great progress.
Are there any more questions for Judge Roberts from the committee? Is there anything more you'd like to say?
No, just thank you very much for, I mean, this wouldn't be happening without the county, effort, and Paul Russo and, all the providers, and Dan Almasi and the Greenberger Center as well. I mean, it's just such a community effort. And just as a quick aside, I was speaking with a task force today, the person who's working on a task force for the state on mental health reform that the chief judge put together. And I showed them this PowerPoint, and they said what's happening in Buckeye County, and they were completely floored that it is bipartisan, community-based, that everybody's involved, and they want to show this to other people, because it's a statewide mental health review effort. So you guys, we're making, I would say history here. Yes. Yes. Okay.
Well, thank you so much. Thank you for updating the committee, and we'll look forward to county full board.
Yes.
Take care. Another step forward.
Thank you so much.
Okay, departments reporting. Up first, we have DSS.
So, hi. I have two social welfare examiners.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
One bookkeeper.
I'll move it. Second.
Further discussion? All in favor?
Aye.
Carried. Opposed? Oop. Too bad out of sequence.
The stats.
Same result.
So the homeless numbers are hovering very high.
Yes. Yeah, without beds.
Okay, any questions for DSS from the committee? Thank you so much for stepping in for the commissioner. County Youth Director.
Just have a few updates for the committee. First, I want to thank everyone who was able to make it to the banquet in May. It was a great time. I really appreciated the support. I appreciate the county support. But it turned out to be a good event, and it looks like hopefully it's going to be your yearly thing now. So anyway, because I missed you, I apologize. So what I'm up to right now is every 2 years you have to do the evals for the programs that we fund. So I'm going through the 2-year evals right now. So maybe 3 or 4 left, and it's one, but I'm trying to get those done so we'll be in line with the state mandates there. The parents as driving partners that we are working with Holly over at the county clerk's office. We're up to 233 signed contracts between parents and kids. It's going really well. Let's see. The circus program that we've working with, they just finished getting Chatham Parks, and they were able to get to Canaan in Germantown. I know it rained a little bit again. Germantown. Let's hope it doesn't rain.
Well, rain last time.
Yeah, I know. So, and they have Hudson and Stockport left, and 4 other town parks. The Think Differently program, we, I should say, the committee was able to fund $1,000 in sensory toys for the the building that we're gonna use again at the Chatham Fair, and we're gonna staff it from noon to 8 with 2 staff. So there's enough funding for that. And then Lisa is now setting up a meeting with the commissioner and the community, see what. This will be a little bit more of an investment, hopefully, on everybody's part.
Yeah, she did a great job. It was a nice room.
Yeah, I think they're gonna be more impressed this time as well. The 2025-26 funding from the state, we lost $1,000 in YDP money and maybe 600 in sports and 600 in team sports. So we didn't keep it all, but we didn't lose much either. So,
Well, in that swims application, I don't mean to digress, but the capital one, the Chatham started applying for that. And if you look at this area with our poverty level, and there's something called the relative index of need for various recreational opportunities, this area doesn't test well for that kind of
and I
funding.
try to tell them it's a false positive because there's just a more concentrated need. And it's kind of like if you're looking at numbers, that's not a really good.
It's immediate disqualification from consideration.
Yeah, unfortunate. But now that you brought up the swims, there's money available for towns, cities for lifeguards, and I think it came out of New York City's issues. But we're available for 25,000. I was unaware of other people, who has lifeguards on staff and town payroll. So I was working with Hudson and Chatham, and we were able to get the application in. I called the Department of State because now we have Gant in Lebanon that wants to join in as well. So they said we can pull it and reapply before next Friday. So just the chunk of money for each town was just split 4 ways instead of 2 ways.
Did you ask first if they can just double or quadruple the allotment?
We're having
I
that.
thought that funding was only for additional training or additional wages.
And additional lifeguards.
Okay, new as in where
Additional, I should say additional.
additional, okay, that's why we didn't qualify, because we didn't have.
You have lifeguards as well?
Oh, yeah.
So does anyone.
So do you?
No, ankle.
Okay, so I didn't
Because
do my
sounds
due
good,
diligence, and I apologize.
Yeah.
We had this conversation.
It's okay, my pot's getting smaller.
Well,
right?
the email went out to the supervisors to ask them if they wanted to participate, to get a hold of Jim Bragg.
Right,
So
Yeah,
that was
I didn't-
on them as well. So
somehow I didn't see
I
that.
read
But
the
after that
text.
very first webinar, I got a hold of him, which was like, what, 6 weeks ago or something.
And we were already working on it.
Let's go.
So anyway,
So I need to talk to both of you, because I didn't understand that we would qualify.
There's an
Right,
entrance
but I-
fee.
Yeah. Charging my account.
but it is, so I sent the information to Jim today because he's speaking to the other towns. So we need to get the updated application in by next Friday, the 26th.
I think we are as well. Has she got the whole?
So that was the question I had for
Yeah,
also.
I think we provide the.
there's a lot of.
A lot of swim
Lifeguards to
programs,
the-
yeah.
We started
Fossil
asking for
campground.
25, and
So-
it was 12.
so Deb-
Now it's 6-2.
My understanding was that your kids took advantage of the swimming program. They weren't funded by your town, you just,
No, we're fine. Pretty sure we're fine.
then that just increases.
Yeah, so we want to get as many people involved and take the money out of denials.
I know. I shouldn't-
Dolls 12.5 is down to 3.4 right now.
It's less than 3-4 right now.
You're gonna be owning.
Yeah. But we do have to, each town has to tailor its application for the aggregate applicant, which is the county. So
Yes.
let's figure this out quick if you guys want to, because we got to readjust our.
I just want to figure if I'm in or out based on what we do. That's all I need to understand.
But
I'll
we're
talk to
already
all
doing
of
it,
us.
so I'm sorry. I'm not.
I think you're all in it because it would cover overtime costs, training costs, additional hours.
You can give bonuses. We're actually applying for certification and recertifications.
And they
which are
said it was
determined.
kind of like open, I mean, they want to give the money, so it's not like they're going to be too stringent with the quals per se. I mean, we all qualify. My concern though is that is Jim going to be the point person for these towns to get to him for information?
Is
to
Jim
explain-
back or is he still?
He's back. Yeah.
He's back.
Sorry, because I didn't hear back from him today and I'm not, because
He was at.
The funding is coming through the county, so he's in charge of the funding. Do you want Dan in charge of the towns or applying to Dan, or do you want him to apply to Jim?
I think you and Jim should work that out.
All right.
Okay, because I had sent him an email to that, hear back. But that's my only concern is that.
We just deal with a variety of
Okay.
issues today, so.
Okay, so now that we have New Lebanon and Ghent, we also have Canaan, Ankrum, and Austerlitz. So that's additional 5. So that's,
now get to $1.380.
I'll give you a buck.
well, what I'll do is, how about if I send an email to those supervisors tomorrow?
Right.
And I'll send you a copy of what we filled out for the original 2 applicants. And it's not much, just to add.
Okay,
Okay, I'll do that.
Thank you, John.
All right, yeah. Kelly did mention that there was other,
Early bird doesn't get to learn.
I didn't really know is this.
You only get the first part of one.
Okay, but while we're here, is there more than that?
That's why I just asked
No.
Dave if Germantown, Greenport doesn't have a swim program.
New program's already started. Yeah, so,
Starts the week after the 4th.
But it's 24, 25.
Mm.
So it's, you can spread the money over 2 years.
Well, and then I think I'm hoping that it would be useful is the most difficult thing we do is retention from one year to the next. So if we can give a bonus that would encourage someone to come back next year, that would make a big
Even
difference.
if you just pay for their training, their
We already- we
certification.
already paid.
Oh, well, that's it.
That's a competitive
Matt,
edge.
We were gonna give the lifeguards an extra $2 an hour for the next 2 years, the lifeguard director an extra 3. Plus, like I said, certification and recertifications.
Okay.
All right, so
But now it's gonna be about
we're gonna cut it
75
between
cents.
7. We're gonna cut it between 7 instead of 2, so that will be.
So we'll adjust our application accordingly. All right, thank you so much, Dan.
I think we can keep our application as is, because you're just asking for more, and you're just gonna get so much. So I don't think we need to change anything on.
We don't need to
Chapter
change the town budget, the sub
Well,
application.
we're already budgeted this year, so. As long as we do it for next year. I mean, if it helps. But you said there's plenty of money in it.
We're gonna do it as an end of year
There's
bonus. instead of a-
25,000 in the pot.
Yeah. Okay, we'll send out an email to see what.
I need to read more closely.
All right, thank you, Dan. Reporting next, Director McGann.
Resolutions today. Request authorization to accept settlement funds from Jewel Labs Incorporated.
Do I have a motion?
Second,
Further discussion?
Did want to ask the director a little bit more detail of what you're doing with it. I mean, I read your list, but,
So that's a
what
very
are you
good
doing
question.
in reality?
Because this is the list that was prescribed.
Right.
We got an email that stated this, and that is all we know. We're
Okay.
hoping that there's some further guidance. But based on what's here, it's stuff these are things that we do through our traditional ATIPA program, Adolescent Tobacco Use Prevention. We also know that the schools got a sum of money too, so we would be definitely coordinate with them because we don't want to be duplicating efforts.
Yeah, just to know if it was an already planned out program for what you're gonna do with it. Yeah.
Really isn't, not
Okay.
yet. It's just the
State
things
throws
that I
out the money,
listed.
just figured it out, right?
Exactly, yes, ask questions later, yes.
All right. Well, we want the money, yes.
Yeah,
we'll take the
exactly,
money.
Just stick
exactly.
it in the general fund.
Right, give it to the swim program, Donnell, and have more swimmers.
Well, not quite, but, we're excited to be able to do some more there.
All in favor?
Aye.
Opposed? Carried.
Request to contract with an agency to provide related services for preschool. This is mini milestones.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And authorization to contract with an agency to provide related services for preschoolers. This is Crossroads Center for Children.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And request to contract with CBH Consulting for staff development day and training on health equity issues in Columbia County.
Do I have a motion?
move it. Second,
Can you explain that, health equities?
Yes, so health equity is a big push from the New York State Department of Health right now. Health equity is a little bit deeper than equality. It's really about looking at people's, at the root cause of the struggle people experience and how that impacts their health. So things like race, socioeconomic status, you know, long-term, long family history of certain health issues, and how we combat those to try to, you know, give everyone an equal chance of life, liberty, and happiness.
Health.
Yes.
State mandated.
And I will better be able to answer that question after this training.
Thank you. I'd like to hear.
Okay, I will do that.
Here's the examples right
Yes,
there.
we've got that.
Disabilities, rural health,
Rural health, what does that mean?
Rural
where they
health.
live.
Access to health, quality of
We have
health care.
access.
Mhm.
All in favor?
Aye.
Opposed? Carried.
Thank you very much. And then I have my director's report presented here. I'm happy to answer any questions that anyone might have.
COVID.
A little bit. We had a bit of an outbreak at one of our assisted living facilities. That has since resolved. It's still out there.
What's this other thing going around? People are pretty sick, don't have COVID, but coughing.
Yeah, so I don't know what it is. You know, they're not testing positive on
Right.
home tests.
Then they went and got a test, for one of those well nows or that
Yeah.
as well. It's still
Yeah,
negative, but sick.
Even the urgent care tests
Yeah.
aren't coming back
Yeah.
positive. I don't know that I'm convinced that it's not some strain of COVID, but
Sounded to me
qualified
more
to make
like
that
COVID with the cough.
Yeah, people have been very ill. Yeah,
Yeah.
we've had a couple, you know, one of our staff was very ill. So,
Well, let's hope it's not the first tendrils of the bird flu. Didn't they just have to inter some incredible amount of birds out in Colorado?
yeah, we're keeping an eye on that certainly.
Yeah, I know people that have tested for the COVID. Well, people that think that have tested positive with COVID and then six then that had that horrible list for
Mhm.
positive, but oh my gosh, bad.
Yeah,
Very bad.
people are really, really ill.
Yeah.
Unless
All right.
there's something else.
Any questions for the director on the health report? Summer camps are all good, water's
They're
clean,
operating.
kids are happy.
Yes, they're awesome.
All right.
I do have a question. Sure. What is the heat index that closes the camp? Is there
The
a
heat index that closes the
Yeah.
cans, I can get that, I can get you that.
Okay, yeah,
I don't have
because
that.
somebody asked me that, and I said I wasn't sure that I was coming to the meeting.
It's every day.
But there's supposed to be like like if it was 102 or 104.
And we-
I didn't realize when the water temperature gets to a certain temperature.
You
they
can't go in
close
the water.
Yeah.
Yeah,
When I lived in Arizona, they used to put 300-pound blocks of ice down so that the
Wow.
kids could swim.
Just like the polar bears.
Yeah.
At the zoo. They
Yeah,
use ice
but
box.
yeah.
Yeah.
Well, that's interesting.
It's supposed to cool.
Yeah,
Thank God.
86.
I had a resident call me up a couple of years ago after like 5 90-degree days in a row. She said, the kids are swimming in the park. The water is too warm. What do you want me to do about it? But I could have airlifted in ice.
That's it.
next time.
Bags.
Drop some dry ice.
Hopefully not tomorrow.
Put some dry ice in there, it looks cool too.
They put some new aerators in, make yourself busy next to those. All right, thank you very much,
Senior
Director.
System for early intervention, is that moving?
So it's set for October. We're having trainings. A lot of it is actually kind of several counties getting together and training ourselves. The state is gonna put on like 1 or 2 and we just don't really believe that's gonna be enough. So there's been a lot of ongoing cooperative work amongst the counties, which hopefully will get us in a good place for when it.
So somehow you're making it work.
And the Lone Star tick is on its way, which I was just reading about today. Have you read about that?
Don't tell me that.
Allergic reactions to red meat.
Yes.
Oh, boy.
Davis Lyons.
Yeah, the ticks are definitely out.
All right, thank you very much, Director. If there's no further questions, I'll bring up Director Almasi. Thank you.
Good afternoon, everybody. Short and sweet agenda today, 4 general resolutions.
First of which is to recontract with one of our psychiatric nurse practitioners. So I ask for your support in this. We certainly have a need, ongoing need. There's a slight increase that she's requesting based on the increased cost to her in terms of her malpractice insurance and such.
And we can absorb that.
Yes,
What was it?
$15 increase for her hourly rate.
Do I have a motion? I'll make the motion. Do I have a second?
Second.
Further discussion? All in favor? Opposed? Carried.
Thank you. Similarly, this is another general resolution to recontract with one of our nurses that is in a contractual period with us. So I ask you for your support in that as well. This is a
I'll
need
move
that
that.
we have.
Do I have a second? Further discussion? All in favor? Opposed? Carried.
Okay, moving on quickly to the third general resolution. This is to contract with Astor Services for a program that they were awarded an RFP by the New York State Office of Mental Health to bring home-based crisis intervention to school-aged children and their families. The purpose of this, I may have talked about it here before, is to divert children away from the emergency department and the need for an inpatient psychiatric stay. This would be invaluable for us, so we're really excited to have this coming to Columbia County. Now, what I'd like to do here is I'd like to offer them space in the Department of Human Services on the third floor at 325. The proximity to our children and family team, the proximity to our children's care coordination team would be priceless. They basically need 2 office spaces for 2 staff that will be rotating throughout the week. And so I'd like your support in being able to offer that. Because
Can I just clarify, we're kind of renting them space in return for services they're providing? For
no
charge
rent.
or-
I've opted not to pursue rent
Yeah,
because
but some service you're getting for it.
yes, absolutely. This service is being offered to the entire county. But since we are one of the major children and family behavioral health providers in regard to the clinic provides counseling to children and their families. And then we have the Children's Care Coordination Program as well under our roof that provides, we call it care coordination, but think of it as case management services, slightly different than the therapy. So those 2 children's services will work very closely. Basically, the families that we serve at the clinic and the families that we serve in our Children's Care Coordination Program are the families that this program will be serving as well. So it makes sense to have them on our floor, proximal to our workers, to initiate timely discussions about these families, coordinate care, know what's going on, as opposed to, even if they were blocks away, you're leaving voicemails, you're sending emails that may go unresponded to for a day or so. I believe there's tremendous value in this, and having them be able to participate in our team meetings and so on and so forth when there's appropriate consents can be a real win. So
there's no cost to the county?
No.
Is that-
none
Right.
whatsoever.
So I have a question, Dan. I'm sorry, go ahead.
No, I just wanted to clarify that there wasn't a
Yeah, but
cost.
we're getting a service.
Right.
That's helping. That's what I wanted to say.
Yes.
So I
And no
don't,
one's getting evicted from
But
that
the
office.
service is being
No one's getting
paid
evicted
for
from the
by
office.
state.
Sorry, multiple questions. Who wants to go first?
The service is being paid for by the state,
Yes,
and we get them 2 days a week
yes,
if we provide space for them.
yes.
Okay.
Not we per se, the county.
The county.
They are, the model is this, that one supervisor will cover 4 staff. So there's going to be 2 staff in Columbia County, 2 staff in Greene County. And there will be 1 supervisor supervising. That's the model that the state rolled out in this RFP. So this is a model that will be offered to both counties. Basically, every single county in New York State will have a home-based crisis intervention program once this is finalized. So it's being brought to Columbia and Greene County. And I'm just suggesting that they be housed in the Department of Human Services because of the value that I just went over. There's no cost to the county. And the beauty of this program is that it's not reimbursed through insurance. So the insurance doesn't create a barrier to accessing this service. The state covers the cost of the program 100% to the families and the children.
so I have a couple.
No, I asked first. so you go ahead.
So A, we have space.
We do.
B, I don't know the procedure. I don't have a problem with it, but so we're letting someone else in one of our buildings. They'll have a key to the building.
Correct.
So how does that get processed through the county?
Yes.
Like letting some, I get it. That's, so I don't know the process.
Right.
But we're
So-
letting someone in to utilize our space, sharing space with,
Right.
with,
So
county employees.
it's,
and-
it's similar to a consultant, who's not necessarily a county employee. We've done this previously, way before my tenure with Twin Counties. Twin County used to have space on our floor. I see the chairman shaking his head. You remember this, Chairman Morrow? This was before my time. So basically, I'm asking my plot for the planner, contract manager, Melissa Sheriff from my office, to work with the county attorney's office to dust off that old agreement that we had with Twin Counties and apply it to this.
So they're vetted.
This is very good. Yes, absolutely.
Being part of the contract, I assume.
We did the same thing with Cameron Woodstock.
Yeah, no, I have no problem with that, just so long as there's a process they would vet it.
Yes.
It's appropriate to have in the building. We know who they are and all of that.
Space wise, just to reassure you, we're gonna be in many cases using vacant offices because our staff are allowed to have a compressed work week. So their staff currently at the Department of Human Services, they work a 4-day work week. So their office is vacant, entirely vacant. So this staff person will go into that office and use it. The staff person will know that. And no one's, protested that. Everybody understands that it's not their office. The office that they occupy belongs to the county. So it's for the county to dictate how that office is being used. And in this case, I'm saying in some instances, we will have to share that office with our new partners from Astor. And the staff understand the value of this and are welcoming it.
So when you say home-based, you mean home-based as Columbia County, having that service available in Columbia County, as opposed to having this person go out into someone's home in the community to provide service?
No, I didn't come up with the acronym. So my take on it would be to define it as home-based in that it is preferential to take that child that is in distress, who has exacerbation of symptoms that might indicate going to the emergency department. And in our case here locally, that child waits sometimes days in the emergency department before a bed is found at an inpatient psychiatric unit like Fort Wayne, Saratoga, or Crotona, et cetera. So if we can deviate that trajectory, if we can, keep that child in the home by offering them this very concentrated dose of intervention through this team, then they're kept in the home. And that's the most ideal place to keep a child, to reduce the acuity, mitigate the crisis, stabilize them, and keep them in the home. This team is very succinct. They come in, they work with a family maybe 4, 5, 6 times just to get in there, and they may see them multiple times a day. So it's very targeted, very, for lack of a better word, aggressive. It's they're in there with the family, with the child, working to de-escalate, but it won't likely exceed more than 5 or 6 contacts, touches. And then they're out. And then they hand off to, for example, the therapist at the clinic or the care coordinators at the Children's Care Coordination Program. If they're not already engaged with the clinic or Children's Care Coordination, then that's where we talk about how do we get them involved? How do we get them in the door? So this team that will be coming from Astor will be working very closely with the clinicians at the clinic, the care coordinators, the guidance counselors, and the social workers at the school districts throughout Columbia County, other children's programs throughout the county, such as Greater Promise Neighborhood and Parsons and others that are here.
Correct. I believe I need a motion. Second,
Second.
further discussion, all in favor?
Aye.
Opposed, carried.
Okay, so last general resolution, the New York State Office of Mental Health, e.g. the state, issued a request for applications not too long ago in regard to Article 31 clinics like ourselves, the licensed outpatient mental health center that we operate. And what they wanted to do is they wanted to offer loan forgiveness or loan repayment assistance. Yes, it is great. However, it's localized to the clinic. Keep in mind,
the Department of Human Services operates other programs, like I mentioned. So this is just going to benefit individuals that have certain civil service titles. Those titles are behavioral health social worker, senior behavioral health social worker, and supervising behavioral health social worker. We had a total of 6 individuals who, once we explained to them what the process was, were eligible. And their applications were sent up to the state and they were approved. Their initials are there. One of the individuals has since resigned. So he is not eligible to receive the loan forgiveness from our department. So we're left with a list of 5 individuals. This is state money. This is not county money that's being given to these individuals to assist them in reducing or paying off their college loans. The amounts vary, $20,000, $10,000, it varies. I think the most someone could be awarded was $30,000. None of these individuals got $30,000. But this is a huge one.
This is a form of retention because the payout's over 3 years.
Yes.
And in order to get the full amount, they
Yes.
have to stay.
They have to remain employed with us as the employer for 3 years. So I have spoken to UPSU. I have spoken to Michael Reardon's office, the County Human Resources. We've spoken with the county attorney's office, and all of those entities are in the process of conversing as to how we can draft language that would be beneficial for us as the employer. So that, you know, if someone leaves in that 3-year period, how do we go about recouping that? How do we make sure that they're putting the money towards their loan? We're going to be asking for a copy of their statement and looking at that to make sure that we see that payment in the sum of as we disperse it. So that's all being worked out, but I just ask for your support in receiving this money. That's what this resolution is.
The state gives us the money once we've qualified the individual, and thank you, client, to their.
Yes, yes.
So will there be a second resolution once the contract is done and?
I'm not sure, Chairman. This one I can't.
It almost looks like we have to
Between
do
the
it every
recipients
year
of those
because it
accounts.
says over a 3-year period. So the funds will be distributed over a 3-year
They
period.
will. They
So
will.
we get a third, a third, a third. So
Not no, it's not dispersed as
That way.
cleanly as that, unfortunately. But yes, there will be 3 payments, but not at year 1, 2, and 3. You think it would be that simple?
Right.
Yeah, but we're talking about old age.
Does this have to be approved tonight in order to do this?
I would appreciate it so
Why
I
would
can
we
move
not-
forward with.
Because I'd like to know some of the metrics as how we are gonna keep track of all of that, making sure that they are staying, not staying, using the money to pay their loans, et cetera. How are we know that?
How does not having that information defer you from supporting just on
Is OMH doing this for every,
Art 31?
all the departments in New York State?
All of the outpatient licensed mental health centers, they call them Article 31s on our mental hygiene law, yes.
So I think-
That's what, I'm sorry, that's why I asked if there would be a second resolution.
I think
Sort
there
of
has to be.
To tie this up at the, you know,
The
I
agreement.
mean, I have no problem with this resolution asking for but then once we get it and we're starting to allocate the money, there should be a second resolution or second adopting a contract.
The contracts with these individuals.
Yes.
Yeah, I follow that.
Say we're
logic.
authorizing the development of a contract, and then we have a contract. Or say that the contract needs to be approved by the county attorney's office.
Because the details that Rob was just asking about can be clarified in a
Second resolution. Yeah, that
I mean,
makes,
sometimes these not this program, I'm something I don't support this, but, you know, these sound great, and then someone takes the $9,000 and pays a credit card off or uses it or whatever. I just want to make sure that somehow someone's making sure that all of that's. being-
yes, there will definitely be a checks and balances.
Well-
The state requires us to have the checks and balances. So that's what's being worked on. This is
So I'll
just,
support the general idea of it as long as we're gonna have a second resolution that defines.
Okay.
that.
Well, this resolution dictates that, doesn't it?
But the other thing that it doesn't do, if we back this out, if we accepted the money and then, let's say 2 of those people look at the conditions of the contract and say, that doesn't work for me, I don't want to do that. It's, that's.
We start getting money back.
say that again.
When we this contract with the employee is
Yes.
developed, the
Yes.
employee looks at the contract and said, that's too onerous, I'm not comfortable with that. So we may have one or more employees that decide not to opt in after they see the contract with the county.
Not likely, but I understand. There's always an anomaly. In that case, we would give the money back to the state,
Okay,
the money that's allocated
So
to that
we're-
individual.
okay, so what you're saying is we're not distributing any funds until the contracts are in place.
Correct,
So the
correct.
money is secure until the
No,
contracts
this
are in
is,
place.
Says to contract with 5 individual employees stated above to receive student loan repayments and the amount stated above to be paid over 3 years. So you. It's-
Yeah, I think
it's-
You
So-
kind of have to give somebody that that's a licensed social worker, that's going through all this kind of education. It's kind of like, being a nurse and you get the piece of the narcotic cabinet. It's on your honor that you're going to repay something that's hanging over your head because you paid a fortune to become a licensed social worker, so
Right.
that you would just, the assumption would be made that you would just pay your loan. You're always gonna have credit card debt, and you're probably always gonna have student loan
Well,
debt,
it's not-
state coming in. I think it's just
I
a
think,
moral and ethically,
I'm sorry, I
that's
thought you were
okay.
finished.
Almost always.
All right, the resolution does state that a further resolution will be done
There you go.
discussing the payout. So do I have a motion?
Second, or I'll give you the word.
I'll second your motion.
Okay.
Further discussion, all in favor?
Aye.
Opposed? Carried.
No. I don't support any taxpayer dollars going to pay for anybody's loan.
Okay.
It got passed, but, on Dave's point, it's like picking that group of individuals. What about this group of individuals or that group? of individuals? Since, that it's a great idea in theory, but it's not really fair to the individuals.
I don't support student loan
Yeah, I
repayment
don't
for
either.
anyone.
I don't either, actually.
You took the loan out, you knew what it was, and
But anyway.
so that's one point, and I appreciate that. Thank you, Supervisor. I also appreciate what you're saying, Supervisor Lagonia, in that, this happened previously in a different form not too long ago when, certain individuals with certain titles in our department received, workforce bonus, allotments to the tune of, I think, $3,000. And other individuals in other titles did not. So it's repeating itself here. I'm not trying to defend
I
this.
think that's a very different thing. I think it's like happens.
Well, what I'm trying to
My
say,
son worked for a company that's a private company. They helped to pay his student loans off. That was part of his.
but it
Was a private
generates a
company,
rub.
it's not taxpayer dollars.
All I'm saying is it generates a rub within the department. There are individuals, because there are individuals beyond the folks in those titles that I listed who have student loans and who would welcome it. They fall under the jurisdiction of the Department of Health. Our 2 care coordination programs are regulated by the Department of Health. The Department of Health could offer something like this with taxpayer dollars, but they've not. The state via OMH has for the Article 31s. So in a situation like ours, where you have these 2 entities housed under the same department, it's not like that, elsewhere. But in our case, it is. It's created, it has the potential to create a rub.
How does the state do this if if I recall, the Supreme Court said it was inappropriate?
They're finding these backdoor ways to do all this. And I think you're gonna see more and more of this between the federal and state governments. There's a lot of movement to do this, as we know. We may not like it or support it, but they're gonna find different ways to direct it through specific departments.
Well, let's remember, this is, again, I didn't craft this. I didn't come up with
No one's
this.
gonna, no one's.
I know. But what I want to say is that this is intended to help relieve the workforce issues, to incentivize people, to get them to stay in these Article 31 clinics so that we're not faced with a desert in regard to vacancies and such. Will it be effective? I don't know. I mean, it's going to keep them there for 3 years.
But you've got some employees that can benefit from this program if we just work along with it. So,
What caught my interest is the retention piece.
Yeah.
Exactly.
For sure.
Yeah. It's unfortunate that only 5 people are going to benefit, and we're gonna lock them into that 3-year retention, Chairman. I wish it was more.
But it's an opportunity that needs to be seized because it'll go elsewhere.
That's one way to look at it, and that's how I'm looking at it, to be honest. It's,
But I think we have to also use every tool in the box. If we have declining population, housing, where it's housing costs, it's very difficult for young professionals to come in and work in the county. If there's a tool that we can find to keep people in our jobs, let's use that tool, whatever it is.
yes. I appreciate your support. I also understand the other side of it. I do.
Somehow the taxpayers end up paying because you have somebody that in order to retain somebody over 3 years, you have to pay them $26,000 salary comes to the taxpayers end up paying it somehow, whether it's.
That's another thought, yes. So thank you for your support. That's all I have. Any questions?
Any further questions for Director Almasi? If not, I will welcome Ms. Benvenuto, Administrator, soon to be Director. hopefully.
I've been working on that one for years. Fast tracking.
Best for last, right, everybody? Okay. We'll make this nice and quick and dirty. So I don't have any resolutions for you. The quarterly report, I kind of zhuzhed up a little visual for you, color coordinated, I like to do things. In the process, it's been a wild couple of days, so I have notes kind of all over the place. Excuse the various papers, ask all the questions you want. But one thing I have been trying to pull together, the team and I, is really track down, kind of where we are touching throughout the county. We're starting that process of really kind of hammering down, and tomorrow at the advisory council meeting, there will be a further conversation on this that you'll see. But I started with taking a peek at our newsletter mailing list, which I did not put on here for you, but I think I'll probably have it on the next quarterly report for you. So the lowest, this is just where we are mailing out our newsletters. The lowest, I think, all at 0, Claremont, Gallatin, Stockport, Taconic, Austerlitz, Ingram, Canaan, Livingston. I also looked at intakes by municipality. So these are intake calls. This is more information and assistance rather than fully coming on board to receive services. The lowest numbers we're getting calls from Taconic, Austerlitz, Gallatin, Lebanon, Ingram, Hillsdale, Canaan. So, it's not a direct correlation just yet, and these are very rough numbers. I just kind of thrown it together after I put this together, but this kind of leads into something I'll touch on in a moment. And let's see. So if you look at last quarter or the first quarter to last quarter, we have gone down significantly in HEAP, obviously because HEAP it's not HEAP season. Same with high cap. Farmers markets coupons we didn't offer last quarter, so they're flying high right now. But home delivered meals, we've gone up. We've increased our numbers in congregate meal sites, and that is because Philmont is officially open. Can I get a woot woot? Thank you. That was an adventure, but we did it. We made it, I'm going to be looking at getting a couple more, breakdown of numbers on this quarterly report, just to kind of really see the kind of progress throughout the county and what we're working on. One thing I did want to mention is that our wait list has gone up, and since this total in front of you, I think I did this Friday. We've gone up 3, so we have a total of 9 right now on the wait list, and those 3 are from a respite program, which again, I will touch on in just a minute. So that's kind of our quarterly report for you.
Why is transportation at 0 in one of these tables?
So that is, we broke down to, if you look at the second table, it's broken down by trips, not by clients served. So I actually think Donna may have gotten me the client served number and I just didn't pop it on here in time, but we had only been reporting it by trips, that numbers of picking up, dropping off. I like that, but I'd also like to see, now, is that 1,900 split between 15 people or 25 people? I know we have our regulars. We're kind of looking at revamping our transportation program a little bit. Actually, Jim Funk, I have to give a shout out, and is it Marcy Wolf, I want to say, over at Healthcare Consortium, have been
an absolute godsend to me. I'm going to them with all sorts of questions. They've been very, very helpful. So there will be, so that 0 is not 0. I just don't have that number for you. There's definitely more than 0 riding on those buses. It's a good amount of people.
The Everhome program went down a couple, right? So we have a total of 91, and it talks about it as a pilot. When does that pilot?
So September is when the Home for the Aged board meeting will come. I don't have a date, I don't believe yet. But September is when they are kind of coming together to do that one last evaluation to see if that next set of money comes around. And I have been working, I would say tirelessly, but no, I don't know if that makes sense. I'm very tired. I don't know how to say that, but we've been working a lot on it. Now this number went down because part of, I think I mentioned this in last month's meeting, I could be making that up. Part of what we've been looking at is really honing in on what is this program meant for? Who is the ideal candidate and context where this system will work? You know, it's got to be a caregiver who is able to utilize technology, right? And previously, this pilot has been targeting more of the individual, the older adult, where realistically, we've been making the pivot over these last couple of months to target the caregiver because it is a caregiver service, or it makes more sense rather as a caregiver service. The tablet itself, we don't have a ton of 90-year-olds, you know, playing games on the tablet. And that's not really what it's meant for, right? It's meant to assist and supplement and almost offer respite in some way.
Yeah, I mean, I was involved in the beginning early on, but
Right.
the number is, from what I remember, is very much lower than what the target
Yes, I believe they have,
population
It was
was.
400.
they have
But even
400
91, are
tablets.
you saying we got 43 new subscribers?
No.
No.
We were at
So that
48.
summation is a
We've
bit
gone down.
So
misleading
what is
by
91?
saying 9.
So there are 91 tablets out. Oh, sorry. No, that's
No,
all
I think
right.
maybe that shouldn't have been added.
You're right. Listen, Excel formulas are
Right,
hard.
that's where my confusion, so we
Yes.
only have a total of 43
43.
in the whole county after 3 years.
Yes. So it's gone down from 48 to 43 because we've really narrowed in on what this
No, I get it.
context looks
I
like.
appreciate that, but I'm saying that was, whether it's 48 or 41 or 51.
Right.
You know,
91.
I'm looking at it as, it should be hundreds by now.
Yes. But we've gone through the
So the
the
whole-
current caseload. This was by my request. I've said, well, now that we have an idea of who we're looking at, that this really will work for, I'd like to work down our current caseload and filter out the people that this is not meant for. Because after, and I'll touch on that, after going to a recent conference, and you know, some of the things I've been talking about with NYSOFA, there are other innovations that I think could fit and fill the holes. Everhome can work great for some people. It's not a one size fits all.
But I guess my question is, at what point do you jump ship, you know, because there's a lot of effort put into this if it's not gonna.
But I don't think we're
There's a lot of
jumping ship. I think the key word you used was pivot.
Yes.
Well, either way,
Changing the focus. And I
fine,
think
but
that's what we need to
then
do.
that has to
Right.
take off, or
So I think
there's a whole lot of effort put into
I
this.
think in September, you know, we've been meeting on kind of, I've been given ideas, I guess, as a consultation kind of meetings, right? Where I'm like, here's what we need, here's what I hear from our clients, here's what we see. And I have seen a good amount of effort to kind of make the pivot. And I think there is effort being made. I don't know if it's enough effort. And I think that September board meeting, when all the players
Just
come
have one more
together.
question.
Yeah.
This originally was not meant for the county to be doing all this work. It
Well,
was,
I'm not doing all the work.
well, it was meant for Everhome.
Yeah.
To get, we were basically referring
we were-
clients, and we were in support of this.
Mhm.
The state backed it, but it was on them.
It's still on them.
Well, it doesn't sound like that.
Oh, no, Ralph, please. I'm sorry, Supervisor Logania. These meetings, every couple of weeks, will come in and I will sit down with a notebook and I will blast some ideas off and we brainstorm, but they're doing the work.
Are they?
Well, they're doing some work. I don't know if it's enough work is what I'm saying.
That's my question.
And when I've been asked to go to that HFA board meeting and present, and I've made it very clear to all parties, if you ask me a question, I'm gonna answer it honestly, and I'm gonna say, this is where I would like us to be. This is where we are. You can decide if it's enough, because they're the ones funding it.
I think in fairness, this program we had concerns about its capitalization and also about its resources, its human resources to operate the program. And certainly for the first 18 months, there were not sufficient resources to respond even to the level of customers that we sent to them. So I think that once that was acknowledged, that, people are trying to better understand what the possibilities are, if any, and the board will decide whether or not to continue to fund it or not. But I think that you have done a lot to bring some rigor to this discussion, to talk about the things, who's being served and who's not being served, and what we need to do to serve people adequately for this to be a successful program. But I think you've done more than this committee expected you to have to do.
Yeah, I also made it very clear in the beginning, we're not gonna work harder than you are because it's not our baby.
That's my point. Right.
And I
don't think there's, in my opinion, that there's been enough effort on their part. not
No.
our part.
I don't think there's been enough. I have seen effort since when I first came in and started that initial conversation. I have seen there have been changes, small changes. There have been changes. Some of the things I have suggested have taken place. I don't think it's enough, but
But regardless of all of that, there's 43 people on this program. It's nothing.
right.
So you can say all of whatever we want to say, we're working, they're working. It's not growing. It's not doing what we had anticipated it to do.
So I have a different question. They have now rolled it out to other cohorts, other populations, to some
Just one other population.
So my question is, let's say that the board chooses not to continue the funding in September. What happens to our 43 people that are on tablets?
I would assume that they would be pulled back in. I don't think that the majority of them would mind if one way or the other. I don't think from my experience, I have not individually interviewed every single person that uses this tablet, but I don't think that anyone relies on it heavily enough for it to be a significant impact to get that tablet taken out of their house. I have also made it very clear that I will not promote a program I do not fully believe in, and where it stands right now, I don't fully believe in it.
It was way more than a tablet when it was presented to us. It was presented with cameras and it tells when they get out of bed, if they fall.
Those do exist.
I know, but I'm just talking about, you weren't here in the beginning, but I was very involved and it was a much more robust system that they were talking about.
But that was elective too.
That was a private
The
thing.
family had to
Right.
make those choices.
Those
A
are
lot of
not
families-
standard.
But we'll know more after we
Right.
reach FID. You have more items on the agenda and we're running out of time. So.
Yeah, I will have definitely a lot to talk about when that comes up in September. I'm also, willing to do side conversations, call anytime. Where are we? We can kind of fly through anticipated community events. All the same, I think, as last month. Recent events, you can read those. The ACUU, Aging Concerns Unite Us, I believe stands for, is a recent conference, 2-day conference that 4 staff, including myself, attended. We learned about a ton of innovations there. And a lot of those innovations, we are now setting up meetings too. And there's 2 different things that I think could kind of, I wouldn't say replace the Everhome pilot, but fill in the holes. And we actually have a meeting, I believe, tomorrow for one of those options. So we'll do a little more research there, and then I'll come back to you with that information. We've got some upcoming events within the community. I just want to point out that fall prevention at the Valatia site, we've actually canceled. Not a ton of people have signed up for it, but I believe we've done 3, perhaps 4. This was prior to me coming on, all with a lot of attendance. So I think it's okay that we're.
It was very successful.
Yeah, it was a really good program. I think we've kind of just give it a little bit of a break for a while. I caught up with Supervisor Adams about the logo redesign conversation from when I was out incredibly ill with the not COVID, whatever that was. Incredibly ill for a long time. So we'll be working on that, and I will bring that back to the committee for you to take a peek at and rip to shreds again. No, I'm kidding. Working on the website rebuild. We already went over and had a little party for Philmont reopening. Very exciting. I do just want to point out that, and I spoke to the county attorney's office just a little bit about this to make sure that I have the right response on this. We're getting a lot of calls regarding the good cause eviction law, so I just wanted to bring that to the committee's attention. Our older adults in the county are aware of it, are asking me about it. I have been kind of just saying, you know, I don't really have any solid answers for you at this point. It sounds like each municipality kind of has to opt in on their own. So if it is something that is of great value to you, interest to you, I suggest you go back to your towns and talk to them.
Isn't that something we would send to Bill Fisher at Fair Housing?
Okay.
So I'll introduce you, if you do not
Oh, I
have his
know.
contact,
We
okay.
referred,
Yes.
Okay.
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 National,
He'll get the.
He's coming tomorrow.
Okay.
National Fair Family Caregiver, this is our respite program, the NFC SP. I just want to bring it to, you know, that wait list is growing and it's mostly respite cases. Their state entity, NYSOFA, has made some changes to that program, which is going to lead to some personnel shifts coming down the pike. And currently, our 2 full-time personal aides are at full capacity, hence the wait list. We, you know, do have the option to go out to those contracted agencies, but that's a very slow process as well. So I just want to let you know, we're getting tight in the respite area. I'm sure more on that will come. We have made changes to the program structure, like I mentioned, and we've shifted, you know, from an endless time of support in home to down to a 6 months structure. And hence my kind of urgency to figure out this EverHome or alternative option as, you know, supplemental support to caregivers. Because respite is very, very important. And there's a lot of need for it. I forgot to put on here, we did have a NYSOFA fiscal audit last week. No concerns reported. Advisory Council, we have some exciting, I guess not news, it's kind of just going over what we expect from Advisory Council that we'll be going over at the meeting tomorrow. I did want to point out that there are several towns where we do not currently have representation. So I'm going to be touching base with those towns and just make sure that, you know, they know that we exist, maybe see if they can appoint somebody. A few of those towns are the same ones on that lower end of the newsletter list, the lower end of the intake list. So I think by coming up with some representation there, it can really kind of bulk up our support in those areas. The personnel, we hired a new per diem aide, which I think should help a little bit with that respite wait list a little bit at least. And then 2 changes to the team coming down the pike. Our nutrition services coordinator will be retiring in August. And then our registered dietitian will be leaving at the end of her contract. That is a contracted position. So if anyone has any ideas of registered dietitians and where they might lurk in the shadows, please let me know because we're on the search. And the last thing I wanted to point out is those farmers market coupons that are live. They're going out. Of the 1, 2, 3, 4, 5, 6, 7 farmers markets that I saw listed on the county website, only 1, 2, 3, 4 have opted in to do the farmers market coupon program. So I don't know if that's something that we could talk about a little bit more in the future. I'd like to see
Definitely.
that option. You know, helps farmers and helps their seniors.
And the availability of these vouchers are where?
Our office, we are going out into the communities, all of our senior sites, a couple of the town halls. There should be a list on our Facebook page, but I can also distribute that if you'd like. I
know our town hall, I'm sorry to speak selfishly, but would take some for distribution because we do have people inquiring us.
Okay. We would have to physically be there, so we'd have to schedule a time to do it. But I can put down Shannon. I went out to a woman's home yesterday. She was 90 years old and on hospice, can't make it into our office, obviously. So I stopped by on the way home. So that's an option too. Just give us a call.
Going the extra mile. Thank you, Director.
Well, it was on the way home, so there's no extra.
All right, anything for Office of the Agent?
Great job, thank you.
Thank you very much.
Anything from the public? There being none, I'm gonna ask for a motion to adjourn.
Motion to adjourn.
Second.
All in favor?
Aye.
Well, good night, everyone. Thank you.
Thank you.